it's Sarah Abraham, and I'm presenting my New York Times presentation. So I kind of based my New York Times presentation around what's been happening in the world right now. Of course, everyone knows that the coronavirus is happening all over the world, which is very scary, but I found it more interesting to do something that was happening in the world right now, and it kind of collided perfectly, so that's what I'm going to be presenting today. So my article was called "The Coronavirus in New York, Bulge of Cases Begins Hitting Hospitals." It's by Brian, Joseph, and Michael, and my summary was that the coronavirus has been growing and spreading at a very high rate to the point that medical systems is towards a crisis point. The article that I read was focused in New York. The organization in New York hospitals has been going downhill. In Brooklyn, the doctor at Kings County Hospital Center says that they are low on supplies and they have been reusing masks up to a week and cleaning them with so much hand sanitizer in between shifts. With a virus like this going around, that should not be happening. Hospitals should be able to have that, I would love to say, unlimited supply of masks, gloves, anything that they need just to be able to protect themselves while also trying to help other people. I find it very shocking that we aren't able to supply our physicians, nurses, any of the healthcare people with the stuff that they need to protect themselves, which is very insane. But many hospitals are losing their sense of organization and the flow of how their hospitals are usually ran. Usually hospitals, some days there might be like a lot of patients coming in, just, I don't know, but their flow is kind of easy because they're able to handle it with the amount of, sometimes they're understaffed, but on a regular day without a virus going around or anything, it's more easier for them to handle the patient flow coming into their hospitals. But the way that patients are constantly coming in, trying to see if they have a fever or just noticing some symptoms, and they want to make sure, they want to check that it isn't the coronavirus. Just a lot. It's not even them staying in the hospitals and being treated. It's more of like the people trying to come in, trying to see if they are able or not able, if they are supposed to stay in the hospital, if that makes sense. But many hospitals are trying to combat this type of flow of people coming into their hospitals. So officials are telling states that they would have to double the amount of hospital beds to 100,000. Ben McVeigh states that the most striking part is the speed of which it has ramped up, which is what the problem basically is. When it's trying to be organized in a hospital, it's kind of hard to be organized when they're probably low staffed, crazy amount of people coming in. It just doesn't work well. It doesn't have to be in hospitals. This can be anywhere. This can, for example, if there's a sale going on in, let's say, Victoria's Secret, they probably don't know that there might not be a lot of people coming in, but they're probably low staffed and a lot of customers are coming in, and they're not prepared, is what that's just how sometimes companies work. They're not usually prepared with the amount of staff that they need, and sometimes they just don't have enough staffs within their company. But yeah, having a steady flow of patients coming in helps with not running a lot of resources. Protective gear is running low, and physicians are scared that they might be in shortage of ventilators. Most states are turning places into temporary medical facilities, which help with organizations of overflow of people who need beds to be taken care of. In the article, it states that they are using Madison Square Garden and the student dorms at New York University. I find that kind of interesting just because there isn't enough space in hospitals. Since it is a virus, you don't want patients being too close to each other, obviously. So it makes sense to try and makeshift a kind of environment to make it into like a healthcare facility temporarily, which is good. So there are 5 significant functions in the evolution of hospital transformations: primitive institutions of social welfare, distinct institutions of care of the sick, organized institutions of medical practice, and advanced institutions of medical training and research. So what I'm basically talking about here is that it's very necessary to have the hospital administration to give a sense of organization to be able to manage the important elements of the hospital. So the New York Times article I read about stated that they're asking retired healthcare workers to volunteer to help, and they are also said how medical students have also volunteered to help what has recently been going on throughout the coronavirus situation. The students are supposed to work as support roles, which means that they're supposed to be taking notes and managing materials, and if the number of cases continue to rise, they might have a chance of being able to start seeing other patients. It just helps with the flow of the ratio of physicians to patients. What I read out of the article is that the medical students aren't really associating with the coronavirus. The patients that are that have the coronavirus, they are mostly going to the ones that are just coming in, like saying they're sick, or patients that have been there and that they're gonna start taking care of, stuff like that. It just helps again with the flow of the amount of people coming in and the amount of people that are on staff. So yeah. So in my conclusion, I stated that this unit has really taught me that organization and staffing is extremely important in healthcare. I've kind of noticed that while I was volunteering at St. Joseph's Medical Center in Towson, and I volunteered on the OGBYN floor, and I noticed that you really never know, not even just on the OBGYN floor, you just never know when you're going to be bombarded with so many patients at one time that it can be kind of hard. And some nurses are coming in thinking just going to be probably a regular shift. We might have a lot of people, might not. It might be a slow day, but sometimes they're even though they think they have enough people on the floor, sometimes they really don't, and that's usually that's the normal amount of people on the floor, which is kind of hard when trying to come into work and thinking you have enough people on your team, but it's really low staff just because you didn't know that there was going to be a lot of patients coming in. But that really taught me a lot. And yeah, not being able to have enough physicians and nurses on the clock when pandemic like coronavirus itself can be very hard for everyone. Not having enough physicians and nurses is just one thing, but not being able to supply them with enough masks and gloves to be able to protect themselves is an issue that needs to have more attention. Organization is another point that is very important in the healthcare, and it's able to give some type of division of work so that every responsibility is taken care of with ease and efficiency. So even if, let's say I had a responsibility of, let's say, stocking the PPE boxes, it can probably be a small job, but since there's so many PPE boxes, we can be able to fill them up, make sure the physician and nurses have the equipment that they need right when they need it, and it's already stocked, and it's not like, hey guys, we're running low, like, can you guys like restock them? It's not like that. It's more of like, let's get into this small group and fill these very fast and have it done nicely, efficiently, and get it done, basically. So that's what I'm basically saying there. Having a structure in a company allows the right people to take care of each of their roles. So physicians are able to spend more time taking care of patients and not worrying about things that they don't need to focus on. Physicians and nurses shouldn't be able to focus on what if the PPE boxes are not filled? What if I don't have my gown when I need it? Like, it's like things they didn't go to school for. They went to school to take care of the patient, cure the patient, have the patient go home. Basically what it is. But it isn't, their job isn't to make sure that their equipment is supplied and it's right there when they need it. We should have jobs that take care of all of that. So it's more of like an easy flow. We just need physicians to focus on what they have to do. People who stock PPE boxes focus on what they need to do. Stuff like that. I mean, most hospitals are like that. But during a pandemic, you need all hands on deck. But this unit was very interesting to me. I really, really enjoyed it. Yeah, thank you.